My name is Caleb Knight, and I will be presenting my case study for medical terminology. We present the case of a patient with extensor carpi ulnaris tendon subluxation who was first treated for distal radio-ulnar joint sprain. A 25-year-old Caucasian man was seen at our polyclinic 1 month after he had fallen on his outstretched hand. He was first treated with a below-arm cast with the wrist at neutral flexion for a distal radio-ulnar joint sprain. 4 weeks later, his cast was removed and we found that he was still having pain and swelling of the ECU tendon during pronation and supination of the forearm. Although the ECU subluxation diagnosis was made clinically, we also had the MRI, magnetic resonance imaging, scan of the patient's wrist, which displayed an increased signal on T2 weighted images consistent with the inflammation around the ECU tendon. Surgical exploration was carried out using axillary block anesthesia under pneumatic tourniquet control. The patient's extensor retinaculum was found to be intact, which was opened longitudinally. However, his fibroseous sheath, which was tightly binding the tendon at the ulnar groove, was found to be torn from the ulnar attachment. The ECU tendon was found to be dislocating during supination and relocating during pronation. The sheath was reconstructed using extensor retinaculum due to attenuation of the subsheath. After the operation, the patient's arm was kept in a long arm cast for 5 weeks with the elbow in 90 degrees of flexion and neutral forearm rotation. The reason for keeping his arm in a long arm cast for 5 weeks was to prevent relocation. The patient returned to normal activities 4 months after the operation. There was no recurrent dislocation of the ECU tendon of the patient at his last follow-up 12 months after the operation. So basically the patient came in and had fallen on his wrist, and they diagnosed him with a sprained wrist and put him in a cast for 4 weeks, and after the 4 weeks he was still having pain and swelling, and so they went and did some more thorough diagnosing through MRI and other things, and found that he was having, and also through surgical means, they found that his ECU tendon, or the extensor carpi ulnaris tendon, was subluxing over the ulnar groove, and so basically it was dislocating and then relocating, and so they went and repaired that and put him in a cast for 5 weeks. And the reason for putting him in the long arm cast was to prevent that tendon from relocating, from going back to what it was doing before. And after 12 months, so they took the cast off. After 12 months, he was still good. He hadn't had any subluxation, so it was a success.